What's up, ladies and gentlemen? Welcome back to Neurosketch with Dr. Ken. But if this is the first time you've seen this channel, don't forget to subscribe. Welcome to Study Practical Question Series, and this is what we have here. Okay, so you're given a tissue here, and the very first question you ask is to name the location from which this tissue was extracted. And the next question is gonna be to justify your answer. Why do you say this tissue is coming from wherever you think it's coming from? Are there any reasons for that? Okay, so let's go back to question number one. Where do you think it's coming from? Take your time, think for a while. But remember, you have only 1 minute to answer all the whole question. So think. I think it's coming from the stomach. What do you think? Okay. So the next thing that we're going to do is to justify why stomach. So let's go to the epithelial type, and this is how you're going to answer the exam in your exams. So you start with the epithelial type. So what is the epithelial type? You take a closer look. See these cells, they are like column. They are column like. So that is simple columnar cells or simple columnar epithelium. And then where do you mostly find the simple columnar epithelium? So they're going to be stomach and intestine. So why is in this intestine? Why is this stomach and not intestine? Because they all have the same, epithelium, the simple columnar epithelium. So next you're gonna see in the stomach we have this, pits. So we see the gastric pits. So the second point will be the gastric pit, the pit in this epithelium, gastric pits. This is very strong point. And then also you see we have glands, so we also have glands. So we have gastric glands, we have gastric pits, gastric glands, gastric pits. And then if someone asks you now to differentiate this from, um, you know, um, intestinal mucosa, you're going to say these, they do not have villi, the villi or villi, I don't know, whatever the name, they do not have villi. This is to differentiate from but the strong points that they're going to use to name this epithelium, to give the location of this epithelium is going to be the type of epithelium. The next question is going to be the pits. The next point is going to be the pits, and last you have the gastric glands. But if you are asked to differentiate it, why is it not intestine? You're going to say it does not have villi or villi, and that's a very, very strong point to keep in mind. Okay, so what do you think? Write in the comment. If you have a question, additional comment, write in the put your thought in the comment section. I'll leave a comment. Okay, see you next question.